Hi, I'm Mark Taylor, and it's time again for the Mark Taylor Show. This week's guest is Elizabeth Eldridge, a music therapist. Welcome to the show. I want to say this is the first time you've been on the show, and it's the first time I've had a music therapist on the show.
Well, I'm happy to be here. Thanks for having me.
What is a music therapist?
It doesn't sound like a real job, does it?
I don't know. As long as it's buying you some craft dinner, I guess it's all that matters.
Yes, it's paying my craft dinner bills. A music therapist basically is someone who's trained to use music as a therapeutic intervention. So we work toward non-musical goals. Okay. And the way that I describe it is picture what comes to your mind when you think of a therapy session. You're probably thinking you're maybe laying on a couch, talking about your problems with someone. So what a music therapist does, it's working toward the same goal of getting, whatever's going on in your life, getting it out there. Only we use music as the tool to do that. So for most people, music is a really effective tool to use because we all have a positive relationship with music. So,
right. Okay.
When you're on your way to work and your favorite song comes on the radio and you think, oh yeah, and you crank it up. Yep. And your toes are tapping and your hands are going and it boosts your mood.
Right.
So we work with all different populations, so it really depends on the population we're working with, what types of goals we're looking at. But
okay.
Yeah, that's in a nutshell.
Okay. Well, where did you go to school to learn about this?
I went to Acadia University, Nova Scotia, and it is a real degree program. So I have a bachelor degree in music therapy.
Okay.
And then we have a governing body, Canadian Association for Music Therapy. And so after you graduate from the 4-year degree program, we have to get 1,000 clinical hours, and that's where we choose our specialization. So for me, I chose psychiatric rehab, and okay. I moved from Beaver Harbor, New Brunswick to Hamilton, Ontario.
Wow, culture shock.
Yeah.
Yeah.
Yeah, there's a few more people there than there were in Beaver.
Yeah.
So I did my specialization in mental health and addiction recovery. I was mostly in schizophrenia services and forensics. So that would be like if you committed a crime and then you went to court and were found to be not criminally responsible for those crimes, you would go into psych rehab in the forensic unit of a hospital.
Okay.
And so that's where I did my specialization. So that was mostly we would get a lot of clients who were not receptive for whatever reason to other interventions. So for example, it might be someone who says, nope, I have no interest in talking about my issues or what it is that I'm going through.
A psychiatrist or anything like that?
Right, exactly, yep. Yeah. But through music, we can kind of pursue those same goals, but a person might say, oh no, I'm not going to talk about it. Oh, but this song, I really relate to it. This is exactly what's going on in my life. Or they might be willing to, write a song about it or something like that. So
are you a therapeutic medium? Is that another term, or is that
we call music the therapeutic medium because music is the tool or the agent that we use. Okay. To pursue those goals. So other areas that people specialize in, I've done quite a lot of work in Alzheimer's and dementia care as well. So the really cool thing about music and what makes it effective with that population is that music is the only single activity that a human can engage in that activates that many parts of the brain are engaged in. Okay. So for example, when you hear, and all this stuff happens whenever we hear music, but we're not thinking about it as it's happening. So picture when you hear that song on the radio and you think, oh yeah, so it boosts your mood and those feel-good neurochemicals are released. Your toes tapping because that's the motor response we have to music, the rhythm, right? Your brain's also processing the melody of that song or the tune of the song. Your brain's processing the language part of your brain is activated because it's processing the words of the song. It's also any memories that you associate with that song.
Bingo. bingo. I thought that's where you were going
yes,
with this. Okay.
Exactly. So for someone with Alzheimer's or dementia, usually that language, well, certainly the memory center of your brain, long-term memory recall, and also the language processing part of your brain, those are usually the first areas to be damaged with dementia. But because all of those other areas are activated, they can kind of make up for the loss of the language center. So if you say to someone with dementia, you are my sunshine, my only sunshine, they might not have a response to it. But if you say, you are my,
and then you usually sing it or play it back on a stereo or something like that, right?
Yeah. And it's usually for someone to engage in it, in live music, piano or guitar or whatever, and to have the person that we're working with participate by singing or by playing an instrument, tambourine or a shaker or something like that. You don't have to be a musician to participate in it, right? But that's where that you sort of build the rapport with the person.
Do you do your therapy with recorded music, or do you play it yourself? Because you're a musician as well, right? So
yeah, a little bit of everything, depending on lots of factors. But usually I'm playing guitar or piano or some instrument, ukulele or kazoo or something like 8 hours a day. Yeah.
Right. So what? So you're telling me that when you're you'd have to have some history on the patient, right, or the client you're working with. I mean,
because whatever. Well, people will say to me, working long-term care or Alzheimer's and dementia care, people will say, "Oh, so you sing all the the old-timey music," and it really depends. Like, I'm 31 now, so when I'm in a nursing home, if a music therapist came in and said, "Oh, well, Justin Bieber was really popular when she was young, so we'll crank up the Justin Bieber," that's not going to be effective for me because that's not my.
No, I wouldn't think
nothing
so.
against him.
No, just saying.
Yeah. So it's we know that musical preference is something really individual. So so that's the important piece, is that it's something the person connects to themselves.
So you would do something like that would be on a one-on-one, right? It wouldn't be in a group session.
Sometimes a lot of one-to-ones, but if one of the goals that we're working at, for example, kids with autism or other special needs, if there's social deficits and that's a specific goal that we're working on, we do a lot of group programming with, in that type of situation. So music is a great social connector too. So kids that might otherwise not have a whole lot in common, or kids on the autism spectrum a lot of times have difficulty picking up on social cues and that sort of thing.
Right.
So music can be a great facilitator for that and a connector, and kind of put everyone on a level playing field. Okay,
because everybody's got somewhere down the line, you're going to find a common ground that you're going to find a song that everybody likes.
Yeah, absolutely. Yeah.
Believe it or not. I mean, if you've ever done dances or anything like that, it's hard to please everybody, but I think there's usually something, as I say, some common ground. So you do workshops as well? Is that workshops and seminars and things like that?
Yeah, I do a lot. Well, I'm like you. I have the gift of gab. So.
Well, hey, there you go. Mr. Talk Show host.
I still do clinical work in mental health. I'm at Central Care in acute and inpatient and community-based care. But from there, I sort of segued into doing some seminars and workshops and training sessions. Yeah. So I'm certified as a facilitator for the Mental Health First Aid training program. Okay. So that's a program through the Mental Health Commission of Canada, and it's the same idea as if you went to take physical first aid and CPR training. Yep. How you'd learn how to manage a crisis situation, or if you happen to be first on the scene at a car accident, or you're at the grocery store and someone's showing signs of a heart attack. This is the same idea, but it's learning how to identify mental health problems and know when someone is in need of help, and then how to effectively offer that support.
Right. When I thought I was going to get you on the show, I know you're going to you do all kinds of things that I'm sure that the viewers probably haven't heard tell of. And that was the first one on me, was the music, the music therapist, and then of course the first aid. So the first aid, mental health first aid, is like those are for employers or anybody, like it could be helpful for them to identify, people that work for them, or even a friend, right? I mean, it's
absolutely, yeah. I get people. I'm almost at the 1,000 mark for how many participants I've trained. So I've done lots and lots and lots of courses, and I've had people from all over the place. Initially, it was a lot of emergency responders like paramedics and RCMP and teachers, I guess. Now we're seeing a lot more emphasis put on workplace wellness and that sort of thing, and which makes total sense because first aid and CPR is standard in a lot of, any government jobs or anything like that, right? So it makes sense that if you're working around other human beings, it's good to be prepared for, as far as knowing how to support someone who's struggling with anxiety or showing early signs of depression maybe, or a substance-related issue. So knowing how to address that, and it can be tricky in the workplace, right? To know how to do it in a sensitive way and that kind of thing. But the biggest element of the course, I think the biggest takeaway, it's a lot of people kind of have an idea when someone's struggling with something. It's just that they don't know what to do about it, or they don't, people say, I knew Bob didn't seem quite like himself, but I didn't want to embarrass him, or I didn't want to say something to make it worse, or, so a lot of it's just about getting your comfort level there so that you've got some skills as far as getting the ball rolling on having what a lot of people would imagine to be a tough conversation, but it's really not.
Because I think there's people, believe it or not, in this day and age, that still find it taboo to talk about.
Yeah, absolutely, yeah. Which is,
and it's becoming a little bit more accepted. It is accepted now that you can go and talk to people because, it hits all walks of life, whether you're rich, poor, or whatever. I mean, it hits everybody. You see people, celebrities that are going through it and everything. So
and it's funny because I make the comparison all the time. The stigma around mental health issues, it's something we don't see around physical ailments, even though we should see it the same way. But there's this idea that if you come forward and ask for help for a mental health concern, there's this idea that you're weak or you don't have the coping skills that the next guy has or something like that. And it's not. Can you imagine learning that your friend had been diagnosed with diabetes and having the attitude that, well, geez, my pancreas produces insulin just fine. Just tell yours to pull its socks up, right? But
suck it up.
And for some reason, the way that mental health issues have been seen for a long, long time have been just, we've looked at it in the complete wrong way. So it's nice to see it getting some attention now. And
I was going to say, you mentioned when you get the first responders and law enforcement and things like that, they run into people who are maybe, they could have been beaten up at a club or something like that, but they also run into people who are having mental issues when they get to the scene of a crime. It could be somebody with a gun or a knife. And knowing how to handle that, I'm sure it's the type of things that you're talking about with your first aid, right?
Yeah. Or someone who's, for an RCMP officer, for someone who's, if you're the first on the scene at a crime scene and someone's committed a crime, it's not to say there's always a mental health issue, tied in, but there's a reason for every behavior, right? And so it's important for an emergency responder to know how to manage it effectively from the mental health point too, not just the physical side.
Right. So these are the types of things that you do. That would be in a seminar kind of atmosphere where you do those things.
That's a 2-day workshop, and so you take that training and then you're certified in mental health first aid.
I was going to say, I'll go, like a lot of offices and stuff like that, they usually have to have somebody there that has first aid. I could almost see this being compulsory, that you would have something like that, because you get working with 60, 70 people, and it could be in a production line, whatever, dangerous machinery and stuff. I mean,
yes, and the number one cause of stress, work, right?
Yep.
So a lot of times that's where if you have an employee who's trained to pick up on early signs, it's much, much better for everyone involved if someone is offered support early on, rather than in the past, I think, and sometimes still now, it's this backwards approach where people think, well, something seems kind of off, but we'll wait and see if it just magically corrects itself. And we know now that that's the exact wrong thing to do, that it's much better, like I say, for everyone involved if the person's offered support early on. And so I'm seeing now a lot of HR professionals and disability case managers and things like that in the workplace. So they're in the process of, Canada's in the process of adopting, national standards on psychological health and safety in the workplace.
Okay.
So it's kind of like how, now there's provincial regulation around physical health and safety stuff, like WorkSafe New Brunswick would be for our province.
Yep.
So within the coming years, I would think it will be compulsory, I would imagine, right? And again, makes perfect sense when you think, we're all human beings, so that's...
And you do these things, not just in New Brunswick, right? You do them...
Yeah, Nova Scotia and PEI too, yeah.
So you do like all the Atlantic province, or maritime provinces,
Maritimes,
I guess.
Yep.
And you say it's a 2-day course, so you go and set up shop somewhere. And are you the only one that's instructing it, or you have other people that are helping you?
No, I do. Well, I am certified to instruct it. There's other instructors within the Maritimes, but yeah, I do it pretty regularly and get to see some cool places. I've actually never had. I've tried to get a course going in Charlottetown. In Charlottetown.
Okay, yeah, I know what you meant. I know what you meant the first time around, but okay.
We might have to edit that out.
Yeah. No, we got it.
But I haven't been able to drum up enough interest yet, but I am trying to get one. I've got one booked for the Garcelon Civic Center this July, so it'd be nice to be able to do one in my own neck of the woods.
Right on. Well, I'm talking to Elizabeth Eldridge. She's a music therapist. You have your own company, Arpeggio Music Therapy, and he had a .com on there, and it's your website.
Yes, that's right.
And what is on the website? I guess it has basically links and things that you can go to. Yeah,
a little blurb about what music therapy is and different places where we're providing services. So I have, there's myself and I have 2 subcontractors, one serving St. John area and one serving the Fredericton area. And so we're all 3 accredited music therapists. And so there's some information on where it is that we're working. And I was saying to you earlier that people often say, oh, music therapy, okay, but what's your real job? And so
yeah, exactly.
There's a bit of information about how it is a real thing.
Yep. So where is the office? In St. George, or?
We don't really have an
office
headquarters, I guess. No, because we're sort of on the road so much, and so we tour around and we'll go wherever people want us to show up.
Exactly. Now, and you mentioned Alzheimer's and dementia. Do you have any family members that went through that, or did you go through it with any family members?
My dad's mother, so my grandmother, died I was in the 2nd grade. She died of Alzheimer's disease, and so I'm active now as a member of the board of directors for Alzheimer's Society of New Brunswick.
Right.
So I've done some. I was, just a kid when that happened, but in talking to my family about that experience. The resources that we have, especially in a rural area, are very, very limited. So the Alzheimer's Society of New Brunswick is an excellent resource for family members who are going through, being caregivers or giving support to a loved one who's in any stage of Alzheimer's disease or related dementia. They do lots and lots of really cool stuff, and they've actually next month the Walk for Alzheimer's is taking place for the first year ever, taking place at 3 different locations in Charlotte County. Okay. So there'll be a walk in St. George, St. Andrews, and St. Stephen. So it's kind of like, it's what Run for the Cure is. Yep. It's the same idea, but for Alzheimer's disease. So it's nice to see. It's one of their mandates is to make it accessible for everyone in New Brunswick. So not just big city hubs, right? But rural areas too, which is great. And
I guess I talked about it off the air, is the things that we really don't, I mean, we're understanding Alzheimer's more than we used to, but we're running into things like concussions with athletes and stuff that are going through, depression afterward and having memory loss. And I guess we talked about Glenn Campbell, who's a musician. He's reached the point now that he cannot play the guitar anymore. I mean, he was, he sold millions and millions of records. Do you run into people who play instruments and that try through your training?
Yeah, absolutely. We have. You don't have to be a musician to participate in music therapy or for it to be effective. But we have clients who are even in late stage dementia. The muscle memory is still there. So if you were a guitar player for 40 or 50 or 60 years of your life, even after we have clients who are completely nonverbal, but you put a guitar in their hands and their hands just automatically move to, or piano players,
is that right?
Move to, yeah, it's pretty neat. Yeah.
But really, other than remembering anything else, you say they're not even nonverbal.
Yeah.
You're on the Atlantic Association for Music Therapy, right? I mean, you're on the, is it a board? Or?
I'm on the board of directors for that. I'm PR chair.
Okay.
And I also serve on our national association's board, Canadian Association for Music Therapy. I'm chair of operations, which sounds like a big fancy title, but it's
well, you got me fooled anyway.
It's a lot of like policy writing and that sort of thing. So we're just trying to convince people that we're, that it's a real profession and trying to get some government regulation and that sort of thing in place so that music therapy is a protected term eventually, because we still run into, people say to me all the time, oh, music therapy, yeah, I do that. I go into, and so the comparison that I make is, if your friend's going through a hard time and you give that person a shoulder to cry on and you listen to them when they vent and maybe offer some advice. You could do a whole lot to make them feel better, but you're not going to walk away from that and say, yeah, I'm Mark and I'm a psychotherapist. It's nice to meet you, right? So it's with music therapy, it's not a protected term yet.
Okay.
We have a credential. The MTA credential means music therapist accredited. So there is some, a bit of governance around using, not just anyone could call themselves an accredited music therapist, but it makes it tricky when, as music therapists who have done lots of training, when we go to a place and say, your facility should have music therapy, it's the best thing since sliced bread, and they say, oh, well, we already have a volunteer who comes in and does music therapy.
Yeah, I got it off a book of matches. I went I went to the course, I went through the mail. But so that's good that you're a music teacher as well, which must come in handy, right? I mean,
for sure. Yeah, it's one of my favorite things about my job is I have what I feel is a really nice balance between, so working in mental health where we have a lot of clients with suicidal ideation and things like that, it can get pretty heavy sometimes. And I do some stuff in long-term care and I do the training things. And then when I'm teaching, so I give private piano lessons, and to have a kid in kindergarten come in and be super excited that they remembered for a whole week where middle C was on the piano. It's a kind of a breath of fresh air, I guess. Sometimes, so it's it's fun to see kids get excited about learning music too.
You told me you have students of all ages too, which is another thing that you've encountered, like even people older than I am, I believe. So and I don't know if there's anybody out there like that, but there probably is the odd person. But so do you incorporate that into talking to people with Alzheimer's, and is there like you obviously you can show them people that could play the piano before. Can they still learn, or they just go by their memory that they had? Mostly
the memory with Alzheimer's and dementia populations. Yeah, it would be more. There's not a lot of focus on new skill development. It would be more kind of maintenance of skills that they do still have, because we know Alzheimer's and dementia, unfortunately, it's a neurodegenerative disease. So we know that we're not sort of focusing on rehabilitation; it's more maintenance. Does that make sense?
Yep.
But working with kids or working in mental health or addiction recovery, for sure, new skill development. Definitely learning an instrument might be part of that. Yeah.
So you're saying you have Alzheimer's and dementia. What other kinds of issues would it help? Would it help with schizophrenia and stuff like that? You run into all these types of people?
A little bit of everything. Pretty well any population you can picture, there's a music therapist somewhere who is working with that population. There's actually I was just reading about a really cool study that took place. Actually, my family doctor partnered with a music therapist at the IWK in Halifax in neonatal intensive care. So what their research was finding is that, this guy who's a music therapist would go in however many times a day and play music in the NICU. And what they found after it was, 6 or 8 months or something like that. So the babies who were born premature and with, health issues and things were gaining weight at a more rapid rate than the babies who were not exposed to music. And so what he and this GP kind of put their heads together, and their hypothesis was that it was not just a result of being exposed to the music, but also because the nursing staff and care providers on the NICU were also being exposed to that music, which was really calming, relaxing music.
Wow.
That's going to change their mood, and probably also going to change, the approach they have to caring for the babies, right?
Okay, yeah.
So it helps everyone.
You must have music going all the time? Like, are you in the car? Are you these people that have music going all the time? Or
do you know what's funny? People ask me that all the time, and I listen to audiobooks or CBC in the car.
No way.
I hardly ever. Music is what my whole job is about, so I feel like when I'm in the car and I'm back and forth to St. John and stuff for work, or and I'm on the road a lot, so I spend a lot of time in the car, and I feel like when I'm in the car, I just want to unwind and relax, and so usually for me, just about any song that I hear, I've got some, makes me think, oh, this client would really love this song, or oh, this reminds me of that session with so and so, and so it makes I still, I play for my own pleasure and things like that. Yeah. But for the listening side of it, I don't do too much of it myself. It's funny, you think, and music is something, I think, for me, I could never get sick of it, right?
Right.
But when it's woven into your work, it's hard to kind of shut your brain off, I guess, when you hear it. Well,
I told you this was going to go fast, and it has, and it's really fascinating to listen to this, because I've never realized the ins and outs of everything, and I really appreciate you coming on here. And
I'm so flattered to have been asked. Truly, my pleasure.
No problem. Well, it's been another episode of the Mark Taylor Show. Please join in next week.